Good afternoon, everyone. This is Amy Stevens at the Health Policy Institute of Ohio. Welcome to the first work team meeting for the Health Behaviors Group for the State Health Improvement Plan, which is work that we're facilitating on behalf of the Ohio Department of Health. We have everyone muted on the call for now so that the lines are clear, but we do want to make this an interactive meeting. And so throughout the webinar today, please feel free to type any questions or thoughts into the question box. We'll be monitoring that. And you can also raise your hand if you want to speak on the webinar, and we'll be watching that. And we will unmute you if you raise your hand, and then you may need to unmute yourself as well if you've muted yourself. Make sure that you've entered your audio PIN. You need to log in first before calling in order to get that PIN and enter it so that you can speak on the webinar. So we encourage you to engage in the conversation either way you feel comfortable. And also wanted to let everyone know that the slides for today's webinar are already posted on the HPIO SHAWSHIP webpage, as well as a list of the outcomes and indicators that we're going to be discussing today. So if you would like to also refer to those or go back to something that we've already covered, you can refer to those materials there. This is where this work team fits in with the overall structure of stakeholder engagement for the State Health Improvement Plan. So you can see the health behaviors work team down at the bottom there. And if you would like to see everyone who's participating on this call today, you should be able to see the list under attendees on the side of your screen. So that is enabled so that you can see everyone who's logged onto this call today. And in the room here at HPIO, we have Haley Aka and Alana Clark-Kirk. Here's our agenda for the call today. We'll do an overview to do some level setting to make sure everyone's on the same page with information about the State Health Assessment and State Health Improvement Plan. Then we'll look at results of the prioritization survey that many of you participated in recently, talk about considerations for prioritizing, and then have a discussion about what to prioritize in the SHIP. We have one objective for our call today, and that is to finalize the desired outcomes and indicators for health behaviors. We're doing this so that we can develop SMART objectives for the health behaviors section of the SHIP. I'm sure many of you are familiar with SMART objectives. They're specific, measurable, achievable, realistic, and time-bound. And here's an example of what that looked like in the 2017-2019 SHIP. So this is just an example of what SMART objectives look like. You can see they get really specific with having an indicator and a data source, baseline data, and targets. And our goal today is to develop something similar for health behaviors. So we're going to be focusing on desired outcomes and indicators today, and then at our next round of meetings, we'll be discussing priority populations and targets. We'll start with a quick recap of the June 4th Advisory Committee meeting. And first, we want to get a sense of how many of you were present at that meeting. So we're going to launch a poll. The question is, did you attend the June 4th Advisory Committee meeting? So please select one of these. So you were there and participated in the health behaviors small group discussion. You were there, but not in the health behaviors group. You participated by phone, or you weren't able to come but reviewed the materials, or none of the above. Okay, so it looks like we have about a quarter of you who were at that meeting and were part of the health behaviors discussion. Haley was facilitating that conversation, and we used that information to build on in this meeting today. But I see there are also many of you who did not participate in that meeting. And so we'll do a little level setting here. What we're talking about today really builds on a whole series of advisory and steering committee meetings that started at the end of 2018. And so if you're just getting involved now, please be sure that you review all of the meeting materials on the HPIO SHA SHIP page so that you can have that background. And we are delighted to have new folks join the process throughout our work this summer. And just hope you can go back and review some of those materials to see what we've been building from throughout the process. And another thing that we did at the June 4th meeting was to celebrate that the state health assessment is almost done. We started the state health assessment process in October of 2018 with 5 regional forums around the state. And the components of the SHA that are listed here are basically complete. And we thank everybody who provided input on these, including through the online SHA review survey that many people filled out last month. And ODH will be releasing the final SHA summary report and the online SHA in mid-July. So be watching for that. And the online SHA is a new feature this year, and it includes county level data and is interactive, so you can pull down all kinds of data to use in your work. So we have another poll question, which is, have you read the draft 2019 SHA summary report? This is a PDF that's posted on the HPIO SHA SHIP page in the materials for this meeting. So have you read all 40 pages? Have you read the 2-page executive summary? Maybe just skimmed it or not yet? Okay, 38% of you have read all 40 pages. That's great. So it looks like for the most part, some familiarity with the SHA. So that's great since what we're talking about today builds on findings from the SHA. But if you haven't yet, we encourage you to check out that draft that's again posted with the materials for this meeting. Here's the overall timeline for the SHIP. There it is. And so here we are in June with this first round of work team meetings. And hopefully everyone has seen the list of all the meeting dates that's posted on the HPIO SHA SHIP page. And I know many of you have already signed up for lots of the meetings, so that's great. I also want to provide a reminder on the purpose, the overall purpose of the SHIP. It's really about getting all of us rowing in the same direction to improve population health. And that's why it's so important for us to be concise and to prioritize toward common goals. I know that prioritizing is difficult work, and it's certainly challenging to have these conversations where we narrow things down, but it really is necessary if we're going to be strategic about working together to improve health outcomes. The SHIP will be a tool to align state agencies. We have a steering committee for this work that includes agency directors or designees from these agencies. And it's also about fostering greater collaboration and alignment between all of these different local level partners and sectors as well. The SHIP is our opportunity to track progress over time. And so far, as we saw in the SHA, the results are somewhat discouraging. We look here at the objectives from the last SHIP that were showing improvement, little or no detectable change, or getting worse. The goal is that we get Ohio in the green. So this is really what we're going for. It's all about improvement, really pushing ourselves so we can get to the point where we see improvement for these outcomes. And the goal is to ensure that all Ohioans have the opportunity to achieve their full health potential. So here we're talking about eliminating disparities and inequities and achieving equity. At the meeting on June 4th, my colleague Reem Ali provided an update on the maternal and child health and maternal and infant early childhood home visiting project, which I will henceforth refer to as MCV, MCH MCV project. We are doing the work of the Shaw and Shipp in conjunction with the MCH and MCV assessment so that we align our efforts and streamline that work. And the MCH MCV group is in the process of identifying priorities, and we're working in tandem with them. So this is where these are the priorities that have risen to the top so far, but this is an ongoing process. And in addition, we had a meeting last week with the Maternal and Child Health Bureau staff to vote on health behaviors, and they prioritized tobacco, nutrition, and physical activity about equally. So there we were pulling in input from ODH staff specifically as well. And again, to remember that these priorities here are specific to the maternal and child health population. Now we'll take a look at the SHIP framework, which will be guiding our overall work. This is the new framework. It is, I want to emphasize, it is still under construction. The areas highlighted in yellow are the things that are still being discussed and worked through on these calls. And if you were familiar with the SHIP framework from the last SHIP, you'll notice that this one looks somewhat different. So we did make revisions. We flipped the SHIP, which was an effort to put a stronger focus on the things listed along the left, particularly community conditions, also known as social determinants of health. We also simplified the language somewhat with those questions that are across the top that are meant to be helpful to folks who might not come from a public health background. And then we've also elevated equity to emphasize that more strongly throughout the SHIP. Here's where health behaviors lives in this framework. So you see the red box on the left. And throughout our conversation today, please be thinking about how health behaviors intersect with the other topics in that blue rectangle there, and also how health behaviors contribute to all of the health outcomes that we have listed in green on the right. These are the main components of the SHIP. So we have our specific and measurable objectives, priority populations. These are groups with worse health outcomes, evidence-based strategies, and strategies to reduce disparities, inequities, racism, and discrimination. Today, we're focused here on the SMART objectives, and then in July, we'll be focusing on priority populations, and then through August, we'll be focused on strategies. Again, this is the objective for our call today so that we can get to these types of SMART objectives for health behaviors. And now we're going to share the results of the online prioritization survey that we sent out a few weeks ago and many of you participated in. Today is about narrowing down and prioritizing. So these are the sources of information that we're drawing upon to set the SHIP priorities. In terms of local stakeholder input, we had the regional forums, and secondary data, we have the online SHA, and then we have input from all of you. the steering committee, the advisory committee, the work teams, which are part of that overall advisory committee, the feedback that we've gotten through the MCH McPhee steering committee, the small group discussions that we had on June 4th, the prioritization survey that I'm going to talk about in a minute here, and then feedback from the ODH Division of Maternal, Child, and Family Health, as well as our conversation today. So all of these sources of information will help us to narrow down what's included in those SMART objectives. We used the discussion from the small group conversations on June 4th to craft the survey, which was sent out on June 5th. And it went to all members of the advisory committee, the steering committee, and the MCH McPhee steering committee. A total of 55 people completed the survey, and that was about a 33% response rate. Our task for narrowing down health behaviors is somewhat easier than it has been for other topics. So for example, community conditions, we started with a list of 7 potential subtopics, but for health behaviors, we just have these 3: physical activity, nutrition, and tobacco. And so we are planning to include all 3 of those in the SHIP. And so our conversation today is helping us to drill down on preferences for specific indicators within each of these categories. Here are the survey results for physical activity. And we're going to use those results to narrow down to the top 3 for consideration today. Here are the results for nutrition. And again, we're going to use these survey results to narrow down to the ones in the red box. And then this is tobacco. And we're going to focus on these top options in the red box. I also want to provide you with an update on where priorities are shaping up for the other areas based on the survey results for the other topics, as well as the other work team meetings. Again, I want to emphasize that nothing is final. And the things in yellow are under construction, including the specifics on the 3 health behaviors topics. But to give you an update on mental health and addiction, it's looking like this one will remain mostly the same, although we are likely adding a focus on youth drug use. Within chronic disease, this one will remain mostly the same, although we are considering adding lead poisoning and bundling that with child asthma as childhood conditions. And oral health will likely be included as a strategy to address heart disease rather than a specific outcome here. Within maternal and infant health, there's strong interest in adding maternal mortality and/or maternal morbidity, and this will replace low birth weight. And it's also possible this category could be renamed. In community conditions, the subtopics that rose to the top in the online survey were housing, economic conditions, violence and trauma, and education. And the work team for that group will meet tomorrow. And then, of course, in health behaviors, we have tobacco, nutrition, and physical activity, and lots of interest in indicators that focus on children and youth, including e-cigarettes. And now I'm going to turn it over to Haley, but if there are any questions about any of the information that I just covered, please go ahead and put those in the question box or raise your hand.
Okay, seeing none, I'm going to take it over. So hi everyone, this is Haley. I'm thankful that you're all in the meeting today and are going to be providing us with your expertise in this area. We are soon going to be moving into discussion and conversation around the different outcomes and indicators that we might prioritize in the health behaviors category. And so this would be an excellent time to, if you have not, put in your audio pin. I'm seeing several of us that are either not putting in our audio pin or are not on a phone or have a mic on our computer. So now is a good time to check, as I'm going to do some level setting and then we'll get into discussion. So yes, we're going to talk about prioritizing outcomes and indicators within health behaviors. First, I want to go over our prioritization criteria. So for any outcome that we prioritize in the SHIP, we want to make sure that we're thinking about these 5 things. We want to be able to track progress on the outcomes that we select. So we want to know if there are measurable indicators available to assess and report progress on the outcomes. And ideally, data would be collected or reported annually at both the state and local level and for subpopulations. Additionally, we would like to look at potential for impact. So this is where we look at evidence-based strategies that we could implement to move the needle on the outcomes that we select. It's also important that we think about connections to the SHIP health outcome priorities. So those are those green priorities that Amy was talking about in the middle of our framework. We want our priorities to be connected to those. We're also concerned about the nature of the problem, the magnitude and severity of the issue, whether there are extreme inequities, the comparison to the US, and the trends that we're seeing here in Ohio. The idea is that we want to elevate Ohio's greatest challenges. And then finally, alignment. We want to make sure that what we're prioritizing aligns with things that are happening at the local level, the McV and MCH assessments that Amy mentioned, other state agency plans and initiatives going on. So these are things that we want to think about on the call today. You all have expertise in all of these things, and that's why you're here today, and we're so looking forward to learning from you and having you share that with us. I'm going to do some really basic level setting on these first 2 bullets, and then we'll get into some discussion. So these are the data sources that house the indicators that we might consider for inclusion in the SHIP in the health behaviors area. You can see some of the pros and cons for each of those sources here on the screen. You'll notice that some of these sources are national surveys that are kind of consistent, updated annually. That might include BRFIS or the National Survey of Children's Health. Both of these have that annual update, which is great, but local level data is limited with these. There are other sources here that are state administered surveys, which is great. Sometimes local data is more available with these, like with the Ohio Medicaid Assessment Survey. But these are often administered every 2 years. I want to do a little bit more explanation on that top one, the Youth Risk Behavior Survey, the YRBS. This is a survey conducted in middle schools and high schools nationally, and in the past, sample sizes have been a challenge with this survey, and because of that, there was no data reported for Ohio in the last 2 survey cycles, so for 2015 and 2017. This year, ODH is confident that data will be available, but we won't know for sure until later this year when that data is released. And it's not clear at this point whether there will only be middle school data available in Ohio or whether we'll see both middle school and high school data. So that's something to keep in mind for the YRBS. That'll come up in conversation at multiple points this afternoon. And I also want to note that the Ohio Youth Tobacco Survey, the OYTS, has been lumped in with the YRBS this year, and so those will be reported together. To echo what Amy said, we will be talking about all 3 of these health behavior topics today. We're not having to select between them, which is great. What we're going to be doing is a little bit of a deeper dive into each of them and talking about which specific outcomes and indicators are most important to prioritize within each of these areas. And we're going to go in this order: physical activity first, through tobacco at the end. Okay, moving in to physical activity. Our objective here is to talk about whether it's more important to prioritize adult physical activity versus child physical activity. So here are the potential indicators that we could select if we were interested in adult physical activity. So this is adult physical inactivity and adult insufficient physical activity. Both of these measures come from the BRFIS, so annually updated. Typically, local level data is not available with BRFIS measures, but because adult physical inactivity is reported in county health rankings, we can get county level data for adult physical inactivity. So that's something to know about these. For child physical activity, these are the potential indicators that we could consider. Child physical activity and adolescent physical activity, those first two bullets on your screen, those both come from the National Survey of Children's Health. And the NSCH is used by the Maternal and Child Health Block Grant Program. So these measures are actually national performance measures through HRSA, and the MCH Block Grant programs use these to track their child health data. So it's possible that one of these indicators could be selected here in Ohio through our MCH plan and tracked and reported through that. So that's something to know about those. The youth physical inactivity measure at the bottom, that's through the YRBS. So that has those data challenges mentioned earlier where we haven't had this measure the past couple of data cycles. It's possible we'll have it this year, but still at this point unclear whether we'll have it for both middle school and high school or just for middle school. So this gets at our ability to track physical activity in the SHIP and whether or not we'll be able to see movement on those measures. Thinking about our potential for impact, are there strategies that we can use to move the needle on these outcomes? Here are some examples of some strategies that might come into the SHIP if adult physical activity is the priority that's elevated. So here we see community fitness programs, so that's exercise programs offered in community settings like community centers and senior centers. Shared use agreements, which allows public access to private rec facilities, sometimes before or after hours, and then complete streets, which are street design that enables pedestrian, bicycle, transit, accommodating sort of all needs in our streets. So the thing to notice about the physical activity strategies related to adults is that they're focused in the community. So these are community level strategies that can be implemented to increase physical activity. Looking at the child strategies, these are much more focused on the schools. So these strategies include school-based physical education enhancements, physically active classrooms, which incorporates physical activity breaks and moving activities and regular academic lessons, and then safe routes to schools, which is a program that promotes walking and biking to school. In the last SHIP process a couple of years ago, the advisory committee felt that it was important to avoid elevating strategies that needed to be implemented in schools and felt much more comfortable elevating strategies that could be implemented at the community level. So we're going to move into conversation now, and we'd like to know if you feel similarly to the last time around, if how we feel about elevating these school-based strategies. If we feel more comfortable with the community ones that would be more related to the adults, and then also our feelings about the indicators in which we think are most important to elevate. So if you would please raise your hand if you have thoughts on any of this, and we will unmute you. Alternatively, you're welcome to type into the question box to provide your feedback, and Amy or I will read that feedback aloud. And we will sit uncomfortably in silence until it happens. Okay, we have a hand raised. Who is it? Oh, Laura Rooney, are you unmuted?
I hope so. Can you hear me?
Yes.
Okay, hi everyone. In thinking about your question of school-based activities, I'm struggling with really deciding what the best answer for that is. But what I want to share is that ODE's new strategic plan has a focus on the whole child. And within that, the time might be right to approach them about how can we bring them into the fold with this, what they think their thoughts are related to using schools for increasing physical activity. They have a new curriculum, newer curriculum coordinator for physical education. They're looking at a lot of different things. I fear of putting a strategy in there because it is home rule, and with all of the competing factors within schools, but it may be an opportunity to have a discussion to include them in this.
Okay, yes, that makes sense to me. Any other thoughts related to school-based strategies and their inclusion in the SHIP? Do you want to read it? We have a question in the question box that Amy's going to read.
Okay. This is from Tiff Hubert at ODH. And she says they have construction in the background, so she's using the question box instead. I think that school-based strategies are equally important as community-based strategies. Children spend most of their waking hours in school for 9 months of the year. And then we have another comment from Anne Weidenbenner from ODH. I agree with using community level physical activity strategies would benefit both adults and children. I think we could expand on the types of physical activity strategies. And that's a great point, and that these are just examples of a few of the types of strategies that could be included in the SHIP, but it's certainly not an exhaustive list. We will get to an exhaustive list later in the summer. These are just a few examples. Okay, any other comments or questions? These are all really great points. Okay. And again from Anne, I would support school-based physical activity also if and when the opportunity exists. Oh, and from Lisa Followay, can these strategies also stress the importance of physical activity for students with physical disabilities in the school setting? This may be addressed at a later time. Yeah, that's a great point. We can certainly talk about how strategies need to be tailored to meet the needs of different groups and make sure that that language is in the SHIP. We can also think about that when we're selecting priority populations for these outcomes. Okay. Oh, excellent. Thank you. Okay.
All right.
Here's another one.
Oh, okay.
From Carrie Hornbeck-Fox. When data sources report data on the calendar year, there may be difficulties capturing results of school-based initiatives that cross calendar years. Yes, that's definitely a challenge of tracking change over time.
Okay. Should we move to the poll?
Yes.
Okay. So we are going to throw a poll at you guys. And this gets at the indicator. So I'm going to pop back to the indicators quick. So we're going to ask you, you only get to pick one. Which of these indicators do you think it's most important to elevate in the SHIP? So you could pick one of the adult-related indicators. Remember that adult physical inactivity is the one with county level data. Or one of the child indicators. The top two are national performance metrics through HRSA. Okay? All right, so I'm going to throw that poll. Pick your favorite. guys are being slow to vote. That's okay. Think about it. But I'm going to continue to wait. Yeah, and the slides are posted to this webinar, which you can go back and look at the information that we've already provided. And there's also the list of all of the metrics. And all of this information is on the HPIO website that you can take a look at if you just need a refresher. Okay, I'm seeing some interesting results. I'm going to wait for like 5 more seconds. So make your last selections. This is great. Okay, I'm closing it. Okay, so adult physical inactivity, that adult measure that gets at the county level data, and then child physical activity through the National Survey of Children's Health. And then youth physical inactivity started to make a break for it there at the end. So that's great feedback. We will take that and continue on. All right. So now we're going to talk about nutrition. Here we are interested in discussing whether or not we should be elevating fruit and vegetable consumption or whether we should be elevating sugar-sweetened beverage consumption. And within fruit and vegetable, we also have the consideration of adult versus youth. One thing to note here is that within each of these buckets, there's actually 2 measures. So the BRFIS has adult fruit consumption and adult vegetable consumption. YRBS has youth fruit and youth vegetable. We will not be deciding between fruits and vegetables. If we can't do a composite measure here, we'll report both. So just know that. And like I mentioned, the adult measures come from the BRFIS. So like we saw before, great national measure, reported annually. Local level data is a challenge on that one. And then the YRBS has the same sort of challenges that we've previously discussed. So those are those fruit and vegetable indicators. Here we see the sugar-sweetened beverage potential indicators. So the first one comes from the Ohio Medicaid Assessment Survey on child sugar-sweetened beverage consumption. This is a state-administered survey. It does get us at a little bit of county level data. Most counties, though, are repressed because sample size is small. The other 2 measures are from the YRBS, so we know the strengths and challenges of that. We've got youth soda consumption and youth daily soda consumption. So this came from the advisory group in our last meeting. We came forward with some fruit and vegetable indicators, and the group said, but what about sugar-sweetened beverages? This is really important. So we've added that here for consideration for the group. But one thing that we definitely want to make sure we think about as we're selecting indicators are the strategies. Okay, this is we have a comment from Laura who's reminding us that the National Survey for Children's Health is a parent report, so it's a survey that parents fill out about their children, and the YRBS is a student self-report where students are answering questions for themselves. So that's really great context to note. Okay, and we have a hand raised, which is great. Okay, Holly, I think you're unmuted.
Hello, everyone. I just wanted to give you a little bit of information about a couple of these measures. The adult fruit and vegetable questions, they have changed over time. They changed in 2017, so that would be the year we would have to use as a baseline. However, most of the BRFS coordinators do not like this module whatsoever. It doesn't really capture what we would like for it to capture. So my guidance would be to not use those adult measures just because the data is it's not what we want it to be. And then I saw that you had another question about the sugar-sweetened beverage consumption. We started asking those questions in 2015, and we've asked them every year from 2015 through 2019.
Okay. Great, thank you. All right. Alana, will you click the slides for me so I can advance? Thank you so much. That is really great context on the measures. Thank you so much, both of you, for that those additions. As we're considering these, I think it's also important to think about the strategies that would move the needle on these outcomes were we to select them. So in fruits and vegetables, we have a lot of healthy food initiatives. Here thinking about adults, and I think as appropriately mentioned before, like this is adults and families in community. There are some measures that we could select. So, or I mean, some strategies that we could elevate. So this includes healthy food initiatives and food banks, healthy food and convenience stores, and fruit and vegetable incentive programs, which offers those matching funds to purchase healthy food. We often think about this happening at farmers markets. And like Amy said before, this is just an example of some strategies that might come in if we were to elevate adult fruit and vegetable consumption. And then when we turn to the children, again, it's a little more school-based. So example strategies here include school fruit and vegetable gardens and farm-to-school programs where schools get connected with local farms to help provide some of the food in the schools. So we have a similar question here around community strategies versus school-based strategies with the fruit and vegetable outcomes. If we were to think about the sugar sweetened beverage outcome as being elevated, here are some strategies that would go along with that. So this includes sugar sweetened beverage taxes, school food and beverage restrictions, and healthy vending machine options. So I think we have some questions here related particularly to political feasibility of what it might look like to include these in the SHIP. But this is a great point to stop for discussion and see what you all think about these strategies and how it impacts how you're thinking about which outcomes to elevate. So go ahead and raise hands, type in the chat box, talk about nutrition for a few minutes here. No strong opinions on vegetables or sugar? I'm going to sit in awkward silence for a few more seconds. So I don't want to miss anyone who has something to share with the group. Okay, we're seeing some comments roll in. So I'm going to throw it over to Amy, who will read them for us.
You got a few comments here from Ann Weidenbenner. Sugar sweetened beverage tax would be very difficult to pass. And we also had a comment to that effect in the online prioritization survey. And then from Tiff Huber, I think that getting soda consumption for the last 7 days gives only an extreme view. It would be nice to see what the daily trends are. Okay, so getting specific about which one of those indicators is better. All right, pause again for a minute here to see if there are any other questions. And just to repeat the point that Holly made, that the adult fruit and vegetable consumption measure from Burfus is somewhat problematic. And then Tiff is making the point here that, can you go back to the indicators for sugar sweetened beverages so we can take a look at that? All right. So we've got youth soda consumption in the past 7 days. And then the last one is percent of middle and high school students who drank a can, bottle, or glass of soda or pop 1 or more times per day in the last 7 days. And so, Tiff, are you suggesting then that that last option is the better one to go with? Is that your understanding? Yes, I'm saying it would only highlight children with excessive use. Right. Yep, these are our choices. Okay, another point here from Ann Weidenbenner. The healthy vending machines and fruit and vegetable consumption is a strategy of the Creating Healthy Communities ODH will be focusing on in the next several years. So data collection will be possible. Okay, and then Tiff is adding that we want to know regular trend on the sugar sweetened beverages. Okay. Well, we have, okay, another comment here from Carrie Hornbeck-Fox. I think the initiatives that influence communities like healthy options at food banks and corner stores will impact both adults and children. Yeah, so that's that similar point that we had with physical activity, that community strategies implemented in the community could affect all ages versus school-based things are more specific. Okay, and then from Tiff Huber, also, I would love a strategy that tracks healthy food in convenience stores. So we can definitely consider healthy food and convenience store programs like Good Food Here as a strategy. In terms of data on the number of convenience stores, I'm sure we could get the number of stores participating in Good Food Here, but I think we'd see that as more of an output or a more kind of process measure to track over time. Okay.
All right, so we're going to throw our first poll for nutrition. We've got sort of a nesting poll situation for nutrition because there's a couple of things to consider here. So first, we're going to ask you which you think is most important to elevate in the SHIP, which nutrition outcome. Are we most interested in fruit and vegetable consumption or sugar sweetened beverage consumption? So I'll give you a little while to think about that. Okay, gonna wait another minute here.
I feel like this is really intense.
It feels intense. Okay. All right, so about 2/3 of us think that fruit and vegetable consumption is the more important thing to highlight in the SHIP. So if we were to do that, if we were to highlight fruits and vegetables, which indicator? And so we talked about some of the challenges related to both the fruit and vegetable consumption metric in the BRFIS, and also just some challenges related to YRBS in general. So if we were to elevate fruit and vegetable consumption in the SHIP, which measure do you think is the measure to look at? Give us some time on this. Okay, you guys are pretty quick with that. So the preference for, again, about 2/3 of us is youth fruit and vegetable consumption through the YRBS would be the favorite. Okay, that is helpful. So looks like we have another question or a comment from Tiff.
Okay, she says, I think we can agree fruit and vegetables are important, but the tracking method is inconsistent. Yeah, and that's often a challenge that we face in selecting priorities for the SHIP, is that sometimes the measurement isn't quite what we would wish it would be, and that's definitely a challenge. And we just need to kind of balance all of these pros and cons as we think about what to elevate.
Okay, let's move it to our third topic, tobacco. So we heard very clearly from the prioritization survey and in conversations we've had with multiple different groups throughout this process that adult smoking must come in, it will come in. So we're not going to discuss that today. we're going to ask some questions related to youth tobacco and nicotine exposure. But as we talk about this, know that adult smoking is part of it. Yes, and as part of that metric, I don't want to flip all the way back to Amy's slides, but there was a slide where we saw the top 3 responses from our prioritization survey when we talked about which tobacco measures were most important to include. You all said youth tobacco use, youth all tobacco use was your favorite. Next was adult smoking, and third was pregnant women smoking rates. So I think that the way the group has moved on this is that we would include adult smoking and use pregnant women as a priority population within that. So that's how the adult tobacco piece is looking as of now. So today we're going to talk about some of the youth indicators and make some more decisions about that. So when we think about youth tobacco and nicotine use, the data source we're looking at is the Ohio Youth Tobacco Survey, which we should have data on later this year, and youth e-cigarette use will be included in that, so we'll finally have some data related to youth e-cigarette use here in Ohio. We heard back from ODH that it will be possible to include e-cigarette use with all of those other tobacco forms in sort of a cohesive measure, a composite measure on youth all tobacco use. So that's an option for us. It was suggested to us that we, through ODH, that we still consider youth e-cigarette use as a measure to itself. So that's something we'll discuss on the call today, which of these we prefer. Alternatively, we could also think about child secondhand smoke exposure. So this is a measure through the National Survey of Children's Health and was also on that list a little bit higher than e-cigarette use, actually, from our prioritization survey that you all were still interested in discussing. So these are the measures we can think about for youth tobacco use and exposure. Regardless of which of these indicators we select for the SHIP for tracking, the strategies are going to be pretty consistent. So these are the types of tobacco strategies that we consider for inclusion in the SHIP. And again, there will be a meeting later this summer where we really dig into strategies, and that'll be an in-person meeting with much discussion. But options for that look like tobacco taxes for all sorts of tobacco products, tobacco cessation, access and utilization, and minimum tobacco age laws like tobacco 21. So again, regardless of indicator, these are the types of tobacco strategies that kind of get at both of these things. So we're going to jump right into the poll. No, we're going to have a discussion. We're going to have a discussion before we poll. And I'm curious what people think about the youth tobacco use measures and whether we're thinking that all tobacco use is a more important thing to measure or e-cigarette use alone. So go ahead and raise hands or type in the chat box. And we're running low on time, so go ahead and type in because we do have one more discussion to have before the day's out.
Okay. Got a few comments typed in here, and then I think we have some hands raised as well. So from Amy Grenflow from ODH, all tobacco use should be addressed. Okay, so speaking in favor of that combined measure. And then Mandy Burkett at ODH, because of the crisis created by youth e-cigarettes, I'd suggest using one of the first two.
One of these two.
One of them. Oh, you suggest using the first bullet or the second bullet?
One of these two, not.
Okay, not secondhand smoke. Got it. Okay, so you're speaking in favor of using the two that are on the screen here rather than secondhand smoke exposure. Got it. Okay. Okay, from Jenna Berkmeyer sitting in for John Belt. I do think that both are important and should be measured. If we used all tobacco use, would we be able to nail down what percent of those are e-cigarettes? It seems to be an epidemic among youth, so it would be good to track. So regardless of what we decide to elevate into the SHIP, ODH will have this information from the OYTS, and we'll be able to break it down for each of these specific things, and we'll be able to look at e-cigarettes versus other types of tobacco products. The issue is because we're trying to really narrow down and focus what gets elevated into the SHIP, what's most important to highlight here. And I'll also mention that the Tobacco Free Ohio Alliance is working on a strategic plan right now. And that plan will go into much more detail on tobacco. Ideally, we'll have overlap between the objectives that are in that plan and what's included in the SHIP. And here we're kind of elevating what is absolutely most important. And if anyone from ODH or TFOA would like to add to that, that would be great. I have a comment here from Mandy Burkett. Use of e-cigarettes would best align with large state efforts. So that's an important consideration to think about alignment with strategies and what could be emphasized in the SHIP. And then from Holly Sabatka, my concern about the combined measure is that we could have progress with one product and not with another. We would not be able to tease out if all products are lumped together. So that's definitely an important point. It might be a little less sensitive to change if kids are just switching between different types of products. From Teresa Lample, given tobacco is a gateway drug, I would recommend using the youth all tobacco measure. So combined. And then Mandy agrees with Holly and Holly's concern about the combined measure. Okay, so we're hearing lots of pro and con about looking at this in a combined way versus separate. Tiff Huber, I recommend youth all tobacco use so we can keep secondhand smoke exposure. Okay. One thing I do want to say about secondhand smoke exposure is that because we're definitely including adult smoking and we're including pregnant women smoking, if you think about strategies to reduce secondhand smoke exposure, really reducing adult smoking is an important way to do that. And so it is kind of indirectly addressed. Okay, Amy Grenflow. Oh, skipping over here. Okay. Mandy Burkett, I think secondhand smoke exposure could be an indicator under MCH. Yeah, and so again, we'll have that overlap between plans. We'll have some things, some objectives and strategies that are in the SHIP and in the MCH plan, but then the MCH plan will go into further detail and have more. Okay, Amy Grenflow, I think the question was asked about whether or not we should address tobacco use in youth of just electronic cigarettes. So that is who I based my answer on, saying all. Holly and Mandy have made good points for sure. Okay. Yes, lots of good points. This is not an easy decision. Did we have a hand raised? No. Okay. Does anyone want to talk about the Tobacco Free Ohio Alliance plan and how that might interface with the SHIP? Okay, we have a comment from Teresa Lample. While I understand the desire to measure e-cigarette use, it's the latest fad, but the goal is to reduce overall tobacco use. That's why I would support all tobacco use as a measure. And we certainly have seen shifting of different types of products. Okay, it looks like we have a hand raised. Mandy.
Hi, yeah, can you hear
Hi.
me?
I can, go for it.
Okay. I just wanted to comment on the TFOA strategic plan since you asked the question. We are in the process of working on that, and, there'll be representation on that committee by myself and a couple of others who are engaged in this process to make sure that direction of that is consistent with what we're talking about for the ship, but it's going to be, a much broader approach than we're able to focus on in the ship. But it will be consistent with it. And certainly if anybody wants to be involved in that, they can let me know and be part of that committee.
Great. Thanks, Mandy.
Mm-hmm.
That makes sense. All right. I'm not seeing any other comments or questions.
All right, so we're going to throw the poll. Which indicator related to youth tobacco nicotine exposure should be included in the SHIP? And again, we're making you choose and you only get to pick one. Yeah, it's harsh, I know. Okay. Wait a few more seconds to get a few more of you to vote. I think I've got like one or two. We really want to hear from all of you, so. Okay, I think that's about it. Okay, well, there we go. No love for secondhand smoke exposure, that's good to know. And that all tobacco use is the favorite. So we're going to have one more discussion briefly, and this is about where tobacco fits best in the overall SHIP framework. So all of this conversation today has been predicated on the assumption that tobacco fits best in health behaviors under the factors that shape our health. Another place that it might fit is in mental health and addiction in these priority outcomes. So there has been some discussion in the mental health and addiction work team considering adding youth drug use as a priority outcome in this area. And youth drug use would have a couple indicators within it, including youth tobacco use, alcohol use, and marijuana use. So we could move all tobacco in there, bring adult smoking with that pregnancy priority population over to mental health and addiction, and have all tobacco in mental health and addiction instead of in health behaviors. So option 1, keep it over here. Option 2, bring it all into mental health and addiction. Option 3 would be to split the baby. We would include, under this option, youth tobacco use would be in that youth drug use measure in mental health and addiction, and adult smoking would be over in health behaviors. So any thoughts about the best way to do this and where tobacco fits best in the SHIP framework overall?
So we'd love to hear from you on this. In the conversations that we've had so far, I think generally what we're hearing is that folks think tobacco use belongs in the health behaviors bucket, to make sure that the word tobacco is prominently featured in the SHIP framework. But we've also heard compelling thoughts about thinking about it, framing it as part of addiction. And so obviously these things are complex. If we wanted to make a really realistic diagram here, we'd have arrows going all over the place and put things in multiple buckets, but it is important to communicate things clearly and to keep things relatively simple so that we can communicate them. But we would love to hear your thoughts on this. Kind of a philosophical question. No one wants to weigh in on our philosophical question? This would be a great one if you want to raise your hand and let us know what you think. Okay, we have someone with their hand raised. Teresa Lample.
All right, so this is a philosophical discussion.
Yes.
So this is one where I think, particularly from a behavioral health perspective, we struggle. And I appreciate the concept because it is an addiction, and we know it is a gateway drug. That smoking and alcohol use are both predictive of later life drug misuse and moving into addiction. It's also, though, indicated as, it's a leading contributor for heart disease and other childhood conditions. So, and we know the disease burden of smoking on chronic disease is huge. So I would not want to split it. I think it needs to be in the same place. And even though I know it's a leading predictor of later life addiction, I think it belongs in health behaviors.
Okay.
Because I think it impacts across all of that. And if we're talking about secondhand smoke and we're talking about preterm births, I mean, it really cuts across all three of the priority areas in terms of impact. So I wouldn't want to see it lost or minimized in terms of the impact and just being an addiction, because I think that we lose something there.
Okay,
that's my 2 cents.
Yeah, and that's pretty similar to what we heard from Dr. Hurst and from some other folks at Ohio Moss. So starting to hear some consensus there. So we have comment here from Mandy. I think it should remain in health behaviors, but should definitely be listed in strategies in mental health and addiction. So that's a great point. The way that we kind of handled this in the last SHIP was that we mentioned in strategies for mental health and addiction, we talked about cessation services being tailored for people with behavioral health conditions. And because we know that there are very high rates of tobacco use among folks in that group, and so we could do that again. Okay, and then Michelle Schuff from ODH says, I think tobacco use should remain in health behaviors. Laura Rooney, well stated, Teresa. Okay. All right. No more hands are raised, and I don't see any more comments. So I believe we have a poll for this.
We do have a poll for this. I'm still curious, though, what this means if we keep tobacco use in health behaviors. Do we think it's important to have tobacco that youth drug use over in mental health and addiction? And I'm sure we'll get into this in the mental health and addiction group, but if anyone wanted to lend thoughts now about that youth drug use outcome priority in mental health and addiction, like if we kept all tobacco use in health behaviors, youth smoking would not be over there.
Yeah, and right now what we're looking at for youth drug use is alcohol, past 30-day alcohol use, and past 30-day marijuana.
So any thoughts related to that before we throw the poll? Teresa?
Okay, we have a comment from Laura Rooney here. Can we have strategies in both areas and still track the same outcomes? Yes, I think I know what you mean, Laura. We can certainly have, like I mentioned, strategies related to cessation for folks with behavioral health conditions, but you're probably thinking more of youth-related strategies. So we'd have to think a little bit more about how to fit that in, but a strategy like Tobacco 21, for example, would certainly fit in the health behaviors bucket, but we could think about how that might connect to the outcomes, the youth drug use outcomes in mental health and addiction as well. So I think there's a way to do it.
All right, and Teresa, your hand was up again.
Yeah, I mean, I would agree with what Laura just said in terms of, having some sort of strategy, if not in the mental health and addiction, attached to, how we're dealing with health behaviors. I do think that in the drug use category, the two things that we know related to alcohol use, and as we're seeing the changing values and belief systems of marijuana as medicine, what that means what we know the research. So I fully support what we have as the early recommendation for youth drug use. And then, but I do think tobacco is the other one. But I still think it belongs in health behaviors because it is so cutting.
Okay. All right, and then we have another comment from Mandy. We really do need to consider tobacco as an addiction and need to work on addressing this within the context of treating addiction, but it needs to be cross-cutting for youth as well. Yeah, so I think there's a messaging element here that we need to be clear in the narrative that goes along with the SHIP that really makes that point. Okay.
All right. No more discussion. I'll go ahead and launch the poll. And these are the three options we discussed. So where should tobacco nicotine appear in the SHIP? Should it be in health behaviors? Should it be in mental health and addiction? Or should we put youth nicotine in mental health and addiction and keep adult smoking over in health behaviors? So I'll give you all some time to vote on that. Okay. A few more seconds. This is another one where we'd really like to hear from everybody. Okay. All right. Great. So this reflects a little bit of what we heard in discussion. Strong suggestion that we keep it in health behaviors. And so we'll bring that back to the mental health and addiction group and have a conversation with them as well. But this has been really helpful input and we appreciate all of you. Okay. That is it for our prioritization discussions.
Okay, well that was really helpful input that will help us to narrow down and refine. And we will be sending you follow-up email in July with the finalized set of indicators. And our next meeting will be on July 25th. And that's where we're going to be talking specifically about setting targets, identifying priority populations, looking at our baseline data. And so I'm sure many of you are signed up for that meeting. If you are going to be on vacation, you can certainly ask someone else in your organization to represent you on that meeting. And since we'll be talking about data and getting into the nitty-gritty of target setting, it would be fantastic to have epidemiologists and other data folks on that call to bring their expertise, and then also thinking about the priority populations. So we've already mentioned pregnant women as a priority population for this group, but we also want to think about other groups of Ohioans that have higher rates of tobacco use, for example, so folks with disabilities. We've talked about folks with behavioral health conditions. And then as we think about nutrition and physical activity, also being mindful of priority populations for those groups as well, including people with disabilities. And I think that there was a comment earlier about tailoring, making sure that our strategies for physical activity are tailored to meet the needs of all Ohioans. And so if you are passionate about any of those things, please participate in those conversations in July. And feel free to recruit others to participate as well. And you can follow up with an email to me if you have any questions about that. As always, be sure to check the SHA SHIP page on the HPIO website, where we will be posting a recording of this webinar and all the materials. And again, if you're newer to this process, we encourage you to review the materials that are posted here so you can see all the work that's been happening over the past few months. Thank you so much. This has been a really helpful conversation, and stay dry, everybody. Thanks.